To whom it may concern, allow me to take a moment to thank you for a wonderful experience that I recently had at Memorial Hospital.
From the moment I arrived at your facility, it was very clear that my well-being was the most important concern to the lady who greeted me on my arrival.
So what I want to go over is some of the things that are important about child passenger safety.
As a team, the Memorial Healthcare System recognizes the importance of treating everyone who walks through our doors like they were our own.
I put myself in a patient's shoes. I always look at that patient and I treat every individual the same way I would want to be treated.
You can definitely influence the patient experience. One way to do that is to put yourself in that situation, to flip roles and see the patient from their perspective.
Morning, Kelly. Morning, Heidi. How's it going?
It's vital for us to remember that it's basically a totally foreign environment for the patients when they come into our center. It's really easy for the healthcare team members to forget that. And the reason for that is we do it every day. Building trust with families and patients, I think, involves going to certain skills, but it's not a cookbook recipe.
We know that the more you communicate and the more that they're in the know, there's less anxiety there, there's less apprehension, there's less frustration, there's less worry.
Gaining their trust means having the smile. Gaining their trust means talking to them in that calm, passionate manner. It's offering a simple cup of coffee.
To whom it may concern, I just want to take a moment to commend your wonderful staff that took care of our son. I don't know how we would have dealt with those 3 difficult days without them. Thank you.
Yeah, you gotta hold on to the strings, don't let go of them. I can learn from anyone. So there's something that I can learn from the environmental person. There's something I can learn from the CNAs. I may see something in the clinic that they see differently at bedside.
We believe so much in teamwork. We believe greatly about making sure that our patients and family members feel comfortable, feel welcome, and have confidence in all the staff.
Everyone is devoted to that patient's care. And if they see that you're working as a team, you're not pulling in 2, 3, or 4 different directions, then they can see, wow, they're my new family while I'm getting better.
And that's a lot of what makes us a successful healthcare system, is that we're considered a team. Everybody works together for the benefit of the patient to make sure that they have the best possible experience that they can.
I could not even complete my job without my entire team, from the beginning of the patient's encounter to their discharge from our clinic.
I love what I do, and I've been doing it for over 30 years. As far as our employees, we make sure that they get the meal that they deserve, so therefore when they go upstairs to the patient, they can provide the patient the best care there is.
All the other departments that not necessarily have that direct patient care, they directly impact the patient.
Every role matters. Every position contributes to the wellness and the well-being of that patient, the outcome, where they walk away and say, wow, not only do they take care of what my medical needs are, but also they take care of me as a person.
I recently had outpatient surgery at Memorial Hospital. Though I was not looking forward to having surgery, my entire experience at the hospital was a positive one. Just everything about the care was really above and beyond.
My job is to provide an excellent patient experience. My job is to provide the best customer service possible.
When a patient has a positive experience across the board, they will heal better, emotionally, physically, mentally, spiritually, if you will.
Only by combining deeper caring with improved efficiencies and improved outcomes can we continue being the premier healthcare system that we are. That's why we have this notion of deeper caring, smarter healthcare.
It takes us to a whole nother level as a healthcare system. It puts us more the cutting edge of everything. We're at the cutting edge of technology. We're at the cutting edge of patient care. Why not be at the cutting edge of deeper care?
Good to see you again. I do become more involved with the patient, but I do it because I love it and I love my patients. I truly do, and I feel the desire and the passion to treat every one of them with 100%.
It is vital and it's crucial that we keep each other on that path to make sure that we stay in line with what's most important, which is our patients and each other.
It's not just a slogan, deeper caring, smarter healthcare. We need to make it happen. When we do the right thing and when we go that extra mile and we focus on our patients as human beings and their health in total, all that contributes to our success as an organization.
Dear Mr. Sacco, allow me to take a moment to thank you for a wonderful experience that I recently had at Memorial Hospital.
I'm on the phone.
All right.
Thanks. Cheers. To go that extra mile for the patient has never been different in the past, and it hasn't changed. What's changed is the additional time constraints now on the healthcare system members, but to compensate for all those stuff by losing sight of the fact that we are looking after human beings, that's not the solution.
When you're passionate about your career and when you're passionate about making somebody else's unpleasant day a little bit more bearable, you go that extra mile, and it's not something that's considered extra work. It's something that isn't given a second thought.
Everything will have an impact on the patient care and the patient experience itself. So just make sure that when you're fulfilling that duty, you give 100% of yourself. And if you're not gonna do that, make sure you have the help that is needed to be able to do that.
It feels great to make a difference in anybody's life, especially a patient. And every day I say, you know what, I love this job, I'm gonna go to work, and I'm gonna make sure I do the best job that I can.
When they see that someone else next to them is loving what they do, that person exudes that energy and that pride.
At the end of the day, there's nothing better feeling than knowing that you could help someone and make them put a smile on their face and hopefully make their day as well.
Hey guys. I'm excited to see what the future brings for us because of the fact that we're here, we're strong, and all of our team members know that they're important.
We believe that efficiency on its own, without continued care for our patients, is not the road to success. We believe in marrying those two principles, and I think that as an organization, we're going to thrive in the future because of those basic principles.
While we fought a terrible disease, we were surrounded by comfort. I will never find words adequate enough to express my gratitude for making this facility and these people available to us. From the bottom of my heart and that of my families, thank you. There are no words. Brendan.
Thank you, Daniel, Valerie, and Louis.
Respectfully, Fernando.
11 years ago, I was diagnosed with stage 3 breast cancer, and at that point started going for treatments here at the Memorial Regional Cancer Center. I was then cancer-free for a few years and then re-diagnosed 3.5 years ago with metastatic cancer to my lungs, breast cancer still, and started getting involved in the research study. My personal status right now, I am considered no evidence of disease. It's under control. I'd like to thank you for just making me feel comfortable and always caring about how I feel and making me comfortable and making sure that I'm getting the care I need.
They do everything to satisfy you, which makes you feel good because here, unless you have company coming to see you, it can be quite lonely. So they try to alter that time, you know, by being good to us. Everybody's doing this for me, and I'm just a plain individual. You know, it doesn't matter. I mean, even if you're the chief of police, when you walk through the door, you're always treated like an equal. And to me, that's a big matter, mentally. All of you make a real difference in my life, and I thank you.
I was about 3 months pregnant when they discovered London's heart condition. They essentially told me that she wouldn't make it through the pregnancy. Luckily enough, she did. She was born full term, One night comes particularly into mind where London was having heart failure. We brought her in. 2 days later, she was on a ventilator because she wasn't breathing well. I actually went into shock. I almost passed out, and the staff was always there to help us through the best and the worst days. She recently, in August, actually had a heart transplant. Be encouraged. The work that you do is amazing. You are truly a godsend to the families that come here. Never doubt yourself. If you're having a bad day, look up, look into the eyes of the kids that you see, look into the parents that you see every day. You are making a difference. And without you, the families here, my family, wouldn't have made it this far.
I want to thank you for your love, your kindness, your patience. Even at times where you knew things were critical, you assure us everything will be well and explain to us, and it brought down our fears, but give us comfort to know you cared because you were there. If it wasn't for you, we wouldn't have made it. And I want to, bottom of my heart, I say, thank you, thank you, thank you.